All right, so I'm gonna go over some patho of shoulder dystocia, and I'm gonna work you through how we would treat a patient with shoulder dystocia, kind of in the systematic approach as a paramedic. So we're presented with the patient who has shoulder dystocia, and that's defined as a birth injury that happens when one or both of the baby's shoulders get stuck inside the mom's pelvis during labor and birth. So how do we treat that? How would we go about treating that as paramedics? So we would use the ALARM acronym, as you can see here. We would ask for help, lift the legs, which is also the McRoberts maneuver. We'd apply suprapubic pressure, roll the patient into the gasket maneuver, and then deliver the patient's posterior arm. We'll go over that in a second. But first, let's talk about risk factors. What are some risk factors involved in shoulder dystocia? So some of the risk factors to the infant or to the baby will be clavicle fracture as they're coming through the birth canal. It could fracture the clavicle, or a plexus injury. Likewise for mom, there's several different injuries that she could suffer. Bleeds, tears, and ruptures of the membranes are all risk factors when we're dealing with shoulder dystocia. And how would we know if somebody is predisposed to delivering a baby with shoulder dystocia? Well, a few things. First of all, is the mother a diabetic? That leads to fatty deposits on the inside of the child, so like childhood obesity. So it's harder for the baby to be actually delivered through the birth canal. Is the baby large? Is it just a large baby? In that case, also increases the chances of shoulder dystocia. Previous episodes of shoulder dystocia would also be a risk factor for shoulder dystocia. And then finally, a hard or prolonged labor increases the chances of a shoulder dystocia. So when we're dealing with the shoulder dystocia, we're looking for the fetal head to be delivered, followed by the chin. But oftentimes, if the shoulder is blocking the birth canal, we would have what's called turtling. So if you look down here, I'll show you turtling. Turtle, turtle, turtle. So baby's kind of going in and out and turtling. Look at the cord around the neck. We don't want that. We've got too many other problems on the go right here. So we approach a patient who is dealing with shoulder dystocia. First thing I would do is I would ask for help. So I call for a second unit or direct my PCP partner in kind of how we're going to approach this patient. So number one, we ask for help. We won't be able to do this on our own. Number two, we want to lift the legs to the McRoberts maneuver. So we want to lift the legs as far back as possible. That just increases the size of the pelvic girdle, increases the size of the birth canal, allows the baby to be delivered easier. Next, we want to apply suprapubic pressure as we have the legs kind of bent back, expanding out the birth canal. Apply firm suprapubic pressure down on the baby. Finally, we want to go to the gasket maneuver if the baby still isn't being delivered. So we roll mother over, kind of into the downward dog facing position here, and we allow the birth to happen spontaneously, guiding the head out. That's called the gasket maneuver. And then finally, we can try and manually deliver one of the arms. So we could reach in there and try and loosen up one of the arms, get it through the birth canal. Once you get it through the birth canal, that opens up a lot more space and the baby can be delivered spontaneously. Now, between each one of these steps, there's going to be a 1 minute time where we don't just skip to the next step each time. It's 1 minute for the McRoberts, 1 minute of applying suprapubic pressure, 1 minute of applying 1 minute of the gasket maneuver, followed by an additional attempt by delivering the posterior arm. So really, we really only want to attempt this 2 times, and if it can't be delivered on scene using all those maneuvers with the appropriate time in between, we want to consider rapid transport to the hospital. So if nothing is progressing after about 8 to 10 minutes, we would move towards rapid transport. And yeah, I can't think of anything else. I think that's good. I think we covered everything. So thanks for listening.